Something interesting has happened recently, and I was following that for the past at least 10 years, and that is use of A1C test to diagnose diabetes. I always argued that if you do a single fasting blood sugar test, first of all, you haven't eaten for 8 hours. There are more chances than not that your sugar will be normal. But once you stress your body with food, maybe you don't have enough insulin, and we will talk about this concept in a future presentation. The simple thing is, when you are fasting for 8 hours, your body had time to control the glucose values or the sugar values. But if you don't test any other values, say after food or something, then you never know what happened during the remaining seconds in the day. And A1C, because it gave average, I always emphasized that it should be used as a test to screen for diabetes along with the fasting sugar. Even if you don't do a fasting sugar and your A1C is significantly high, say 7 or something, I will say you have diabetes, and maybe in the next few months, years, this concept will catch up. These things keep changing. Till 1997, a sugar of 140 milligram percent and above was diabetes. Now it is 126 milligram percent and more. However, with A1C, the latest is that you do A1C test to diagnose diabetes. Previously, it was only used to manage diabetes, to see if the diabetic control is good or not. But now it is recommended that A1C test should also be used to diagnose diabetes, and that's a very good development, and I strongly urge you to get your A1C test done along with your test for diabetes, that is fasting blood sugar. The A1C test, now some recommend for people who are at higher risk of getting diabetes, like people who had pre-diabetes, and we talked about that, a fasting sugar between 100 and 125 milligram percent, or for women who had diabetes when they were pregnant, then the diabetes disappeared, called gestational diabetes or pregnancy diabetes, or for patients who are on certain medication that can cause diabetes. But I personally will recommend to you that get an A1C test done along with your sugar test. It's a very cheap test, costs less than $20, some places even $10. It can even be done in your home, like a blood testing strip. There's a strip available now, you can buy from the pharmacy and do it. But an early diagnosis of diabetes can help prevent so much complications and so much damage to organs, leading to disability and poor quality of life, that it's worth doing this test. As I said, I repeat, the test costs $10 to $20, can even be done at home, and if you request your doctor during your annual checkup, he will be glad to order it for you, because now the test is covered for diagnosis of diabetes too. I hope you understood the value, significance, and how A1C is generated, and you will share this knowledge with others, that they can also understand the value of getting their A1C checked, remember the values and follow them if they are normal, and to act on them till they become normal.